You are listening to Seniors Junction podcast. Your hosts, Dr. Namrata Bagaria, Dr. Shabnam Daskar, and myself, Dr. Paul Merkley. Our guest tonight is Dr. Richard Fisher. Welcome. Richard, please tell us about yourself.
Well, I practiced family medicine in a suburban community just on the edge of Toronto, Canada, for 34 years, full-time practice. The last 12 years with a large team of 14 physicians, about 20,000 patients, which was a very pleasant experience. And we had a lot of allied health professionals, such as nurse practitioners and nurses, social workers, a dietitian, pharmacist, all on staff to help us manage the patients. So the practice included, of course, as with any family practice, a lot of senior patients, and also worked for some of my career as taking care of inpatients in a hospital, nursing home or long-term care, did a lot of house calls, palliative care, so a variety of settings were worked in.
That's wonderful. And I was very curious to know what you mentioned you worked with seniors, and what specifically is your experience with seniors or senior social isolation?
Well, it's unfortunately something that you see fairly regularly. Certainly when I worked in the nursing home, long-term care, a lot of seniors would come in who had been fairly isolated at home. So it was a common problem. Also with your own patients in the practice, it was often a challenge to manage their medical needs because there was often a lot of logistical issues in terms of communicating with them, transporting them if I wanted to refer to a specialist in a different community, which is very common in the area that I practiced. It was often a logistical challenge to get them from point A to point B, even with the often excellent systems we have in public transit. Taxis are expensive, but obviously can be used. So these are some of the issues we run into. Certainly having the team available when you had situations like COVID is very useful, because once it became evident that the pandemic was going to be lasting a while, my team started phoning seniors who we felt would be relatively isolated, making sure that they were doing okay, that they knew the restrictions, that they had enough medicines for themselves, and generally trying to make sure we were making sure they were taken care of. So social and physical isolation too. I mean, very often people will have people that they can communicate with by phone, by internet, lots of seniors use email now, but sometimes the physical isolation, just being able to get out of their living space, could be quite a challenge sometimes. Yeah. So it, as a family doctor, you have to be adaptable and creative and customize your care often. Yeah.
So, Dr. Fisher, thank you very much for that. Now, as a physician, how much of the social as well as the physical isolation did you find affecting their blood pressure management, or their diabetes, or their cognitive functions? Like, would you say the social isolation was it had a huge impact, or it was kind of not that significant? Other than the COVID time, because you've been seeing them for a long time.
Right. Yeah. And before COVID, It very much depended on what assistance they had from others. If there was local family available, things worked often very well, but very often that wasn't the case. So we would often bring in home care. Pharmacists could be very helpful in terms of connecting us with patients, keeping an eye on them, especially since seniors are often on a number of medications. And if the pharmacist noticed that Mr. and Mrs. XYZ was not filling their prescriptions either regularly or perhaps too soon, double dosing sometimes by mistake, that obviously would impact greatly on their physical health, blood pressure control, etc. So yeah, it's when you have somebody who is living alone, it's often a challenge to keep things organized and moving smoothly forward, for sure. And that clearly has an impact on their health. Can, anyways.
Thank you.
What would you say is your vision for tackling problems like seniors isolation, which to us is a very big problem?
Yeah, there's several components to that answer. One, I think, is that as people get out of the workforce and start to enter the senior part of their lifestyle, to remain connected as much as possible to friends, family, organizations, to take up things that they may not have tried before, belong to clubs, religious organizations, the library. I mean, there's a lot of organizations that can be very helpful, and I think societies, depending on what the medical condition of the person is, can be very helpful. Heart and Stroke Foundation, Cancer Society, Alzheimer's Society, etc. United Way all have excellent resources that can be utilized to help people who either are or are at risk of becoming isolated. So these are things that families, friends, neighbors can utilize to make sure that the isolated person doesn't become more isolated. Safety is a key thing with isolated individuals, because if something happens to them, there's nobody around to help. So if financially it's possible to get the devices that detect falls, for instance, ideally the device that detects a fall that a person does not have to press a button, because if they're unconscious, then obviously they can't press a button. That can be an important addition to their safety while they're alone, living alone. As part of our home care teams, occupational therapists can come into the homes and assess them for safety. And this is can be a very helpful adjunct to the care and to their protection, basically. Services like Meals on Wheels, for instance, as well, who will regularly see people, can be very helpful in just monitoring a person who is a bit isolated. And they tell me they make a conscious effort to do that, keep an eye on their clients. So there's, of course, I'm talking in the Canadian context, and in or near a large urban center. I realize that a lot of areas, rural and lower income countries, don't have this range of resources. But these are some of the ideas that people can work with.
It's very interesting you mentioned so many possible solutions. But in terms of the present day, like if we think of what's already there and what's immediately needed, what do you think are the opportunities and what are the challenges in implementing those solutions?
In implementing seniors junction specifically, or
Yeah, it could be not senior junction so much, but in solutions for tackling seniors isolation, like what are the different range of opportunities? Like for us, we identified Zoom video call as an opportunities to connect
yes.
people. So that's an opportunity for us. But the
Mhm.
challenge for us is we also have to significantly invest time for training people who can use the our technologies fairly well. If they may know how to join a call, but maybe to use all the features of the Zoom, because there are many features like breakout rooms and all. So those are the challenges where within the senior junction context. And so similarly, what like as a physician or as a person who's worked enough with seniors as in practice, what do you think are the different opportunities that are missed, and what would the challenges come if those opportunities are thought or taken up?
Mhm. Mhm. Yeah, I think that one of the partially missed, because we've worked very hard on um, maximizing or improving our services. But one of the partially missed opportunities is that just that there are a lot of services out there, and sometimes it's the challenge is coordinating them and teaching people that they're there and they're available to be accessed. And so to spread the word, so to speak, about what is available, is very helpful. And certainly we were, very active, in my team doing that. Um, and this is where organizations like public health, the organizations that run home care, retirement homes, can to make sure that the word gets out to them as well, um, that these services are available, and having a sort of a central clearinghouse for organizing the services that are available would be a great starting point. And not just looking at government services, it can be private as well. Why not? So that's, I think, one would be one further step ahead. I mean, there's already a lot of work that's been done, but it would be one further step ahead. And certainly, like I say, more and more seniors are on the internet and IT savvy, so that having the links available and the websites available that they can access this information makes a lot of sense. It's not only mental but also physical abilities that are important as well, and to have some way to encourage people to develop those as well. Certainly when I worked in long-term care, nursing homes, the people who were there, the physiotherapists, the activity workers, just getting people who had come in who clearly had not been doing any exercise at home, just getting them moving up and about, improves their balance, reduces fall risk. It's just simple things like that can be very helpful.
Thank
And
you.
I think there's evidence, good evidence behind all of that.
That's wonderful. That's because my PhD thesis is actually to help seniors get moving, and that's why I see Shabnam smiling.
Mhm.
So what happens is when you, like for the listeners, when you do research, there's a different way of doing work, and when you do a startup, there's a different way of working. What's scalable, what's doable, and it's hard for us to sit far away and have people work out through Zoom, and while we monitor different parts of the screen. So though it was an intention, because if you look at the way the Canadian aging guidelines have what's important for seniors: physical activity, social connectedness, nutrition, falls risk, and de-addiction, like no smoking and not having alcohol, kind of a thing. Those were the couple of tenets of healthy aging in the guidelines. And then as the company, we want to first do something which we can reach to a lot of people and in a very urgent sense. But I think what my takeaway from this podcast episode is that even that one step, like you mentioned, like one step of centralized services or one step that people know. And that's positive too, because a lot of time when researchers like us innovate, or when we want to do innovation, we think of big things and fancy things like, okay, let me make that next robot, or let me do this and that. But we forget the basics, right? And I
Mhm.
think for me, this was a very grounding experience, that first get that right and then think of all the other fancy things.
Yeah, there's been a tremendous amount of work already done in this field, and sometimes I found that it was amazing what you discovered when you started looking for services, and so much so that we and my team, just in the last few years, we hired what we call the care coordinator to do exactly this, to try and pull together services for particularly exactly isolated, frail seniors who were really having trouble navigating the system on their own, and to have them just to be able to be coordinated to what services in fact are available, was a big step forward. Yeah.
Thank
Yeah.
you. So, Paul, what was your takeaway? And Shabnam?
Things you said resonated with me. The word connected that you used, and the idea of picking up a hobby or doing something that maybe you used to like and set aside while you worked or had your family. How much satisfaction I have had from picking things back up again that I used to do and set aside for a while, whether it's music or whether it's playing tennis or whatever it is like that. These things that connect us with other people, that give us a reason, something to look forward to, instead of just feeling limited. When
Yeah.
and when we combine a couple of challenges together, I was thinking as you were speaking, if you live by yourself and you've lost your spouse, these things can compound the feeling of social isolation. When my wife died, the mortician said, hey, you'd better get yourself a social network. That's the thing he said he saw most often with men my age, that you lose your wife and you just sit there and you feel badly and your life is almost over like that. So, we have to make these sorts of efforts. I'm glad that we're doing what we're doing. I'm glad we're offering interest things that people can maybe pick some things up, and that we're trying to address it. Thank you very much.
No, it sounds good.
No. Oh, go ahead.
No, Dr. Fisher, go ahead.
Yeah, and I think one thing that we do have to remember too, and this came up in my own personal life with dealing with my mother, in fact, is to also respect the seniors' desires, and the balance between wanting to deal with the isolation, physical and social, but also respecting their desire for independence. And that trying to find the right balance there is important, because people still want their independence as much as possible, and this is where connecting with a family doctor or nurse practitioner, or whoever their primary care provider is, and the team behind them can be very helpful, and not to forget that connection, and other professionals, like I say, like pharmacists who are seeing people on a regular basis, to keep an eye on them.
Thank you.
Thank you.
Shabnam.
Very relevant. Yes, Paul. Oh, well, what did I get from this?
Yeah.
So, yeah, what I understood is, I think where probably we can be the connection, as you said, Paul, is number one, there are a lot of services already available. And Dr. Fisher, as you mentioned, you needed a coordinator, a person to actually coordinate all of these. So one is a lot of things already exist, but I think many a time people are not aware of what are the services that are already available. And then, of course, to that, we can add another level of the kind of services that we on Seniors Junction are providing. So actually, Dr. Fisher, you've given us a lot of hope that, because you deal with seniors every day, all the time, that, something like what we are starting off with is going to be very helpful and really very, thank you so much for that. That's really very important.
Oh, my pleasure. My pleasure. Yeah.
And thank you to our listeners. Thank you, Paul. Dr. Fisher, do you have anything parting to say, Dr. Fisher? I think I interrupted you.
Well, best wishes in your efforts, and I think that it sounds very exciting, and I think that this has great potential to help a lot of people, which is very much needed in our current environment. That's for sure. And I wish you the very best in your efforts.
Thank you. Thank you.
Thank you.
Thank you, everyone.